our next speaker. She also is a senior research scientist at ARC. She's a Harold Robinson Chair, the Arthritis Society Chair in Arthritis Diseases, also Associate Professor at the Department of Physical Therapy at UBC. And Dr. Lee, as with Dr. Saber, stands very tall amongst her research colleagues around the world. So please welcome Dr. Lee.
Good morning. I'm so delighted to see all of you here. You know, even the weather is so bad, and I want to thank the organizer for inviting me, and to welcome all of you online who's watching this morning. So what I was asked to do is to talk about what are the right things to do in osteoarthritis. But before I start, I'm going to tell you a little bit about myself, because I don't think most of you know me. So I'm a physiotherapist, and I'm also a health services researcher. And I love both of it, because as a physiotherapist, I can help people individually, but as a researcher, I can also, do things and find new knowledge that can help a lot of people out there. So what exactly do I do? A lot of my research is mainly to look at what are the gaps that are out there in providing care for people with arthritis, and the way we do it is to measure it. So once we find out what is wrong, what the problems are, then we're trying to find ways to fix it. Now, some of my research look at ways to provide better treatment. So as a physiotherapist, we look at ways to teach people to do exercise, models of care. So what are the better ways to deliver services for people with arthritis? And also, recently, we started collaborating with people in computer science to develop some really cool interventions that we can use online or in mobile devices, like an app or web-based intervention. So now we create the intervention, and what do we do? Now, as a researcher, we do the research, crunch the number, and if it works, we bring it back into the community and try to fix the problem and make everything better. So that's what I do. So now let's go back to the question that was trying to address. What are the right things to do when you have early osteoarthritis? But perhaps the more important question is to, first of all, to ask, how do you know that you have early osteoarthritis? Now, there are different ways to identify arthritis nowadays. The most currently being used when you go to the doctor's office is that the doctor will do an X-ray and see whether there are damages in the joint, and subsequently give the diagnosis. But we also know that in using X-ray, actually from some of the research from Dr. Saber, comparing what you see in X-ray and what you see in other better imaging techniques like MRI, we know that people who have knee pain, you go to get an X-ray and you go get an MRI, more than half of the people who show damages in the joint or changes in the joint in MRI does not actually see anything on their X-ray. So X-ray is not perfect. However, that's a current way it's being used. However, not everybody's getting an MRI, because obviously this is expensive way to do it. So, Dr. Saber is very smart. What she did was that she did a study to look at different ways to measure or to examine people's joints, in particular the knees, clinically, and compare what they find and what they see on the MRI. And she found that there are actually a couple of very simple physical examination and a couple of good questions that doctors can ask and do in a couple of minutes, and can easily identify people whether they have osteoarthritis in the knee. Now, obviously, this is the beginning of this type of research, because I keep talking about the knee. I haven't even talked about the other joints, but let's bear with me for now. So if you want to know what are these sort of exams and questions, Dr. Saber also make it into a movie to teach doctors and therapists to be able to do these examinations and ask the questions. And for those of you who are wondering who this older gentleman is, it is Leslie Nielsen. So he was arguably, that Dr. Severe was the last leading lady that he worked with. And for those of you who want to see more about the video, go to YouTube, search for osteoarthritis and Leslie Nielsen. That's the first video that's going to come up. So we're coming back to the question, what in early osteoarthritis, what are the right things you can do? In the earlier talk, you've heard about some of the things that are good for people with osteoarthritis, but what I would like to focus on is actually exercise, because as you know, the recommendation for you to continue exercise is very strong, not only for early osteoarthritis or osteoarthritis in general, but also for your general physical health. So now, the obvious question is, how much is enough? The current recommendation is that all of us need to be physically active, moderately physically, do moderate intensity physical activity, at least half an hour for most days of the week. And what does that mean by moderately intensive? So let's say you go out for a walk. If you're just going window shopping, walking along slowly, that's probably not enough. But what we encourage people to do is to pick up the pace a little bit so that you may feel a little bit warm, feel maybe a little bit sweaty, and a little bit out of breath, but still can carry out a conversation. Okay, so that's around the level of moderate intensity. Okay, so half an hour every day investment in your health, it's all worth it. Now, for people with osteoarthritis, there are specific recommendations that health professionals should do in terms of guiding or helping people to set up the exercise that is right for them. So there is something that we use to measure whether those who need care get the care, and it is called quality indicators. The quality indicators usually comes with two statements. One statement identifies who are the people who need care, and the other statement tells you what kind of care that should be received. And I'm going to use exercise as an example. So the quality indicator for osteoarthritis suggests that if a person is diagnosed with osteoarthritis in the knee or the hip for 3 months or longer, and that they have no health problem to prevent them from exercising, then the doctor or the therapist should really prescribe the exercise and review the exercise program at least once a year. That's the minimum standard of care that should be received by everyone with osteoarthritis, especially for those who are at the early stage when the damage tends to be milder. So now we know what to measure. What do we go? What did we do? We went out and asked you whether they're, those who need the care, whether they get the care. We did a survey in British Columbia in 2008 and surveyed about 1,700 people with hip or knee osteoarthritis, and the results was astonishing. I'm going to show you just part of what we found. We asked people who whether they get exercise advice and advice on weight management, which you've heard already. That is another intervention or another area that should be focused on for people with osteoarthritis in the knee. And what we found, what did we do? And what we found was that the screen go black. Okay. Aha. I was told by the research table I don't have a degree in IT, so bear with me. So what we found was that only 1 in 4 with osteoarthritis actually get the advice they need to exercise and lose weight. That's a big problem. So how we solve the problem? We did a new study, a new project that I would like to introduce you. We developed an intervention called Osteoarthritis Physical Activity Exercise Network, and this is a new study. What we did is that we used some really current behavior theory, And we are using the intervention at a time that when the person just gets diagnosed with osteoarthritis, which we call a teachable moment. And what we did was that we have this website that's being developed to help to coach people to set goals and find ways to be physically active. Now, we don't expect people to do everything alone, so we actually have a therapist online that helps to give tips and advice for those who may be trying to exercise but may find difficulties to continue. We're currently recruiting people for this study. We need 252 people in this province with early knee osteoarthritis. We will assess them for a variety of things like activity, symptoms, fitness, and whether the site helps to motivate them. And we need your help. So what I'd like you to do today is that go look for our study flyer. Charlene Yousefi, who is our research coordinator, I don't know where she is or whether she's here now. Oh, she's right there. That's the lady you need to talk to if you're interested in finding out more about our study or participating. And we need someone to help to test our website. So just to summarize, what are the right things to do when you have early osteoarthritis? Be active. Keep a healthy body weight, and you'll hear more about it in the subsequent speakers today. And like today, to learn more about the condition, because what Dr. Sever has mentioned, that there are lots of things that you can do to help stay healthy and help to manage the symptom as well. So I'm going to end by thanking all the people who helped to collaborate in the study, particularly two of the consumers from the Consumer Advisory Board, who really helped us to shape the research question. Nadia Grizzly and Joyce Ma. Joyce is right there. Nadia is over there, so thank you.